Marketing, Don Sherman.
Good morning, everybody. Thank you very much. My name is Don Sherman. I'm CTO at Pega. I run our product marketing, but most importantly, for the next couple days, I get to be your MC and your guide through Pegaworld. And the first thing that I would like to do is officially welcome you to Vegas, baby! Yeah! You know, as Alan pointed out, this conference has gotten so big that when we look around for a hotel that can fit us all, Vegas is the only place that we can go. And it's great to be in an entertainment capital like this. It's great to have Ravi Drums here kind of playing us in. Yeah, and all right, stay ready, right? And, all right, here we go. I've always wanted to do that. And the reason this conference has gotten so big is that you bring so much great content to it. You know, over the next couple of days, we're going to have 75 breakout sessions and workshops and boot camps outside of these great keynotes. We're going to have a general session. And 100 of your peers are going to be in these sessions telling their stories. You're going to be able to go into the tech pavilion and see 100 different demos of Pega technology and the things that our partners and our technology ecosystem is doing on our technology. And we want you to be able to get out there and share this with the world. So hashtag Pegaworld is the social media tag. You can do that on Twitter, you can do that on Instagram, you can do that on Snapchat. We have Snapchat geo-filters set up for the pool, for the arena. If you guys don't know what a geo-filter is, you can text your kids and they'll explain it to you. Bam! We also have a Pegaworld mobile app built on Pega Cloud and Pega Mobility technology. That's the best way to get at the information on the agenda, the sessions. We're also going to be using that for a little bit of real-time interaction later today. So if you haven't downloaded the app, go to the Apple App Store or Google Play, type in Pegaworld, and you can find it. And of course, we're going to have some fun. So tomorrow night, we've got the Goo Goo Dolls. We have the Goo Goo Dolls right back here. We're going to turn this room into a very intimate, private concert with the Goo Goo Dolls. You have the chance to win a backstage meet and greet with the Goo Goo Dolls, and the way to do that is to tweet and post on social media and go check in the booths at the Tech Pavilion. The more you do that, the better your chance of winning. I can already announce our first winner, Hans Hoffman, who has been actively tweeting. We'll get to go backstage and meet the Goo Goo Dolls. Yeah. And then tomorrow night, we are going to Hakkasan, which is one of the hippest nightclubs in the world right now. You can probably tell that I know these things about hip nightclubs. And Hakkasan is the place to be. You can see Kardashians at Hakkasan, you can see Biebers. If you look closely, you may see Alan Treffler dressed up as his favorite character from The Hangover. We're gonna have a lot of fun. You know, this morning, Alan talked about what it takes to become human, to really engage your customers in a digital world. And he talked about how that took insight, the ability to really understand your customer's context, action, the ability to get things done for them and actually make it easy to cut through your silos, evolution, the ability to change. And as we were preparing for Pegaworld and talking about this, I was actually reminded of something that's kind of a passion of mine, which is improv comedy. Now, believe it or not, I actually have spent 20 years on the side doing improv. I just did a show on Friday night. The audience was not this big. I met my wife performing improv comedy. And if you've ever taken an improv class, there's a mantra you will have drilled into your head again and again. And it's this concept of yes and. This is a sacred creed of improvisers. When you walk on stage with another performer, your first job is to listen and understand the context that they are presenting, to yes what they say. And your next job is to bring something to the table, an insight, an action. You and what they say. And that's what allows the scene to grow and evolve. Now, you were probably all thinking, Don, this is great. I'm sure we could run like an HR offsite team building around this stuff. But what does this have to do with digital transformation? Well, prior to the digital world, we treated our relationship with customers like we were the director. Like we could lay out a script and a storyboard and a pre-planned journey and just get our customers to follow it. If they needed to get something done, we would put them into our processes, force them to find the right department who could actually solve their problem. But in the digital age, customers aren't going to operate in that way. They don't want to be directed. They don't want to follow your storybook, your script, and your process. They want to engage you on the channel that they choose, when they want, how they want, and they want you to be ready to respond with an insight and an action that will make it easy. So if we want to engage these customers, we can't act and think like directors. We have to think like Amy and Tina. We have to think like improvisers and be ready to engage with an insight and with an action to get things done. And if we can do that, we can change the way that we engage our customers and we grow our business. Because so much of the world around us is changing so fast. You know, one of those buzzwords that Alan talked about was the Internet of Things. All of the sort of connected devices that surround us in the world. And those are impacting all of our industries. A great example is what's going on in healthcare, where the world of connected devices is allowing us to deliver types of care to patients in different settings that we never could do before. It's just having huge impacts to how we engage in that industry. And we are really excited to announce today a partnership with Philips to actually bring together their Health Suite, which is a cloud-based platform that collects data from all of these different connected devices, and our care management application that actually helps guide nurses and care professionals in delivering the best care for patients. And I'd like to show you a quick video that talks about what we hope to be able to do together.
What is empowerment? Technology has always been a constant force for empowering people. It has made our lives better, inspired us to innovate. Medicines have cured diseases and doctors are now able to see things once never imaginable. And yet, healthcare is still as complex and fragmented as ever. That's why together, Philips and Pega are leading a revolution to simplify and connect the healthcare industry. What if patients could be monitored in the comfort of their own homes, meaning less time recovering in a hospital? What if their care team had a complete view of vital information, so their care plan could be updated immediately, adding specialists when needed? What if payers were able to reduce costs, all while helping patients get healthy faster? Through its network of medical-grade connected health devices, products that people are using every day in their own homes, and the Health Suite Cloud platform, Philips is providing patients with the tools to self-manage their health, giving them peace of mind and providing important data to caregivers to improve health outcomes. And Pega helps patients, their families, and their care managers by driving tailored care plans, providing upfront visibility into costs, and automating the complexities of health coverage so patients focus on what's important, getting better. A care manager will be alerted at the very moment a patient's vital signs are abnormal, helping to determine if this is common or a more serious matter requiring immediate attention. On the flip side, they can also see when things are going well and reach out to congratulate a patient. Philips and Pega together means always knowing where you are in your health journey. For the first time, making you a part of your care team, putting you and those who care about you in the driver's seat of your health. Now that's empowering.
So to tell you a little bit more about that, I'd like to welcome to the stage our partner and somebody who's built a career driving technology and innovation, and now CEO of Connected Care and Health Informatics at Philips, Hereon Tas. Hereon?
Thanks. Wow. It's wonderful to be here. And let me tell you about the first time I met with Pega. I'm going back 20 years. 20 years ago, I worked at Citigroup and led our tech lab here in California. And we were actually the first one to launch internet banking. And a lot of people came up to me and say, wow, that's great, but you know, you're wasting your time. Nobody is going to ever trust their financial data to the internet. Forget it. I said, well, I think it's a good way to interact with customers, gives them convenience, but we have to link it. It's not just an isolated experience. We got to link it back to the back office. We got to really understand who our customers are. And that's when I met Pega. So we connected our front end in the internet world with the back end, and we started crafting great experiences for customers. We started looking at our customers in a holistic way, and we found out we have about 2,000 segments, each with their own needs for products and services. We found out that real-time information is really valuable. And strangely enough, here I stand 20 years ago in the same discussion. People tell me, well, you know, health data is very sensitive. We cannot put it in the cloud. And at the same time, we look at a world where patients say, where people like us say, it's about us. It's about us. The care should be organized around us. And with that, we're looking at a lot of the parallels that we learned in other industries and applying it to stuff that really matters to us. To me, I suffer from hypertension, but more importantly, my daughter was diagnosed with type 1 diabetes. My father has been undergoing surgery 9 times for colon cancer. Yet, we're like you. We're a normal family. And if you think through all these experiences, and you think about how much better we can make them, I think that's the discussion of today. And what you see here on the left is what I learned in financial services. If a system is very complex, you need to be able to visualize it in a way that we as humans can understand it. And what you see in the middle is not the bright lights of Las Vegas. It's actually a modern plane, where actually the information you see on the screen automatically adjusts to the context of the way a pilot is flying. And on the right-hand side, you see a modern virtual care hub, where specialists, where nurses, intensivists monitor your health and be there 24/7, ready to reach out, to intervene at the right moment, at the right time, at the right place. Concepts that we all well know, but not fully embraced yet by healthcare. And that's our mission. That's our mission with Pega to jointly address that world, because we have a challenge. We have a huge challenge. Look around you. 1/3 of the people in this hall today will be diagnosed with cancer in their lifetime. 1/3. 500 million people suffer from respiratory disease, COPD, asthma. 500 million people suffer from diabetes. More than 1 billion people suffer from hypertension, the silent killer. This is a huge issue. Now, if you look at the United States, we spend $3.2 trillion on healthcare. $3.2 trillion. That's more than the GDP of Italy. And somebody said it's as badly governed as Italy. The US alone wastes 25% in the healthcare system. That's more than the entire GDP of the country I'm from, the Netherlands. We have an issue. Now we have an issue, especially if you look at it in the context of where disease is going. And we can apply what I call the 40-30-20-10 rule. 40% of your health is determined by socio-economic factors. You know, where you grow up, your education, your income, the social structure around you, which has a huge influence on your behavior. Your behavior determines your health. How you eat, how you sleep, how you exercise, what you drink. All of this determines your health. 30% of the health determines. 20% is clinical. You know, the medication you take. And now I'm going back to behavior. You know that 50% of the people don't take their medication on time. 50%. So we're spending all this money on the pharma, and yet 50% of the people don't comply. So now you know what we're getting at. We need a better way to help, control, support, and help people. The last 10% is water, our environment, the air we breathe. So we're on a mission. We're on a mission where we center everything around you. You, the people around you, the family. And the people around you are as important to you as your clinician. Because if 50% of your friends are smoking or overweight, you have a probability of 50% you will be smoking and overweight. So how can we help you take better care of yourself? How can we help you to help your friends and family? How can I help my dad? How can I support my daughter? These are the questions we're asking ourselves. And then we're looking at how technology can support us. How can we create the case for you that you carry along throughout your life? And we learn as we go along. And we aggregate your information with others like you, and we learn. And we plow that learning back into the daily care. So that's what we're doing. And while we're doing it, we're going to support a change in system. We're going to support the change from what we call episodic care to continuous care. Episodic care means you wake up with chest pain and shortness of breathing. You go to your doctor who says, well, this looks really bad, you better see a cardiologist. And then sends you to a cardiologist. Then you get a treatment. You follow that treatment. It's not continuous, it's discrete step. It has to become continuous. Because if you're suffering from a chronic disease, you're going to be suffering the rest of your life. And it's not that you can step out of it. My daughter has to make 180 decisions every day related to her health. 180 decisions. She cannot take a weekend off. She cannot take a break at night. It's there, 24/7, 24/7. So we need to orchestrate care 24/7. We need to move from care provider-centric care to human-centric care. If you go into a hospital, you see all these esoteric terms. You know, it's very hard to navigate it. It's not organized around you. It's organized around caregivers. It should be organized around you. The care is fragmented. My daughter deals with 10 different disciplines. She found out that they never talk to each other. You know, if you have diabetes, you have complications. You may have psychological issues around it. Complication may be with skin, with kidneys, with psychological areas. She's the only one who aggregates the information because these people don't talk to each other. They're in different organizations. How can we bring them together? Carry one case that everybody contributes towards those outcomes that Ellen talked about. Because we've got to move from a system that's fee for service, we pay for the procedure, to we're paying for the value that's being created. The outcomes for us, the patients. And therefore we need to be outcome oriented. We need to be continuous, we need to be 24/7, and we need to collaborate across organizations. And we need to look differently at care. We need to look at a continuum where we want to be living healthily, but we may be at risk. I'm at risk, I know it. So I have to prevent illness. So what can I do? How can I adjust my lifestyle to make sure that I don't deteriorate or that I get exposed to an acute event? Should that happen, how can I make sure that when I go to the hospital, they have my history, they know who I am, where I'm coming from, what my family situation is, so that they can do the right diagnosis there and then. You know that 30 and 40% of the more complex cases are misdiagnosed. And only afterwards we're finding out. It's very hard to turn the situation around. You know, in the case of a stroke, that the cost and the risk of dying is exponentially higher as time progresses. So the earlier we can be there, the better we can treat it. The same with cancer. Stage 1 cancer typically can be managed. Stage 3 cancer, very hard to manage. Stage 4 cancer is terminal. Yet, the system is not organized around early detection, prevention, and best diagnosis. And best diagnosis you can only do if you really have that deep knowledge of you. Because we're all complex systems. We're all unique. And you know, the truth is, even our cancers are truly unique. So, if we do the first time diagnosis right, we have a treatment plan that fits with you. Not only from a medical, clinical perspective, but also from a personal perspective. You know, treating you in the last year of your life, which happens to be the most expensive part of the treatment of your life, by the way, when it comes to healthcare, is quite different from treating us, still, you know, in the strength of our life. If you want to spend the last year of your life living in dignity without tubes coming out of your nose, you may have a different approach to healthcare. If we look at what people really need and the risk they're willing to take and the control they can exercise, the discipline they can bring to the treatment, it will be different for all of us. And then, of course, it shouldn't be confined to the hospital. You know, most people with chronic disease spend 99.999% outside the hospital. Yet, we don't have the systems to support you. And that's why we're coming together here. That's why we're discussing how technology can enable that continuum. So we're in a great place. You know, we're in a tremendous period of our lives when it comes to technology. We're in a unique situation where all the knowledge that we collect, we can actually turn into knowledge about you. So we can create really rich profiles. So Philips has been doing for 100 years, starting with X-ray images. We've been making images of people. And we can do a full anatomical analysis of, let's say, a cancer. We can see how it grows over time. We can measure the volume changes. We can even see through image interpretation whether the cancer cells are alive or dead. But that's not sufficient, because as I said, cancer is a personal, unique disease which is driven by the DNA of your cells. So we're doing digital pathology. We're taking actually tissue and we're looking at the cell structure, you know, making the cell Google Maps of your cancer. Then we can decide which cancer cells are important to take a genome sequence on. And now we know a lot. We're going really, really deep. We're going to the level that actually wires who you are, the book of life. And then we apply that and we create this holistic view, not about the cancer, but also about you, about how you will be able to deal with your treatment, whether it's chemotherapy or targeted drugs or surgery, how you deal with it, how we can support you at home. We're bringing care to where you are. I'm wearing a medical device. The watch you see is a proposition we're actually co-developing with Allianz, and you'll hear about that next. We're basically looking at a set of tools to coach you, and it's not just the wearables connected to an Internet of Things platform, medical Internet of Things, the weight scale, the blood pressure cuffs, SpO2 meters. It's really about coaching you, giving you these little nudges every day to get you to the place where you want to be, that sweet spot of health, of control of your health. You know, but when we get older, we're getting constrained. And, you know, most people over 65 have one or more chronic diseases. We see the onset of neurological disorders like Alzheimer's. But still, these people typically want to live at home, like my dad. He wants to live at home. Don't put him in a home, in a care home, because he will die shortly. So what we've done, we created this little device that people hang around their neck. It's a fall detection, but there's also one big button that you can press any time to get support. But we're also doing fall prediction. How do we do that? First, we analyze your medical records, your history. Then we calibrate the way you walk around, and then we can see that as you're getting up more slowly, your gait is changing, suddenly we see an increased risk. So we can intervene. And we're working with Pega systems to really create that 24/7 mission critical, because a fall can mean death if we're sending help too late. So we want to send help there and then. So we're connecting you. We're connecting you to medication device so that we can increase compliance with medication from 50% to 96%. And especially elderly people that are on 10 medications and have problems remembering when to take which pill. We're giving them the tools to augment themselves, to remember what they have to do, to support them around the house, and to make sure they're being watched over 24/7. We launched a service. It's called ultrasound. We do ultrasound as a service. You can use your own tablet. We'll ship you the probe and all the intelligence in the probe. And you say, okay, great. I tell you, it will change the way we practice medicine. Because going back again to that case where you wake up with chest pains, you can go to your GP or your GP can come to you. With the ultrasound, they will scan your heart, and in real time, a cardiologist sitting anywhere in the world can collaborate with the GP, and together you can do a diagnosis, set up the treatment plan there and then, in real time. Today, what's going to happen is you go to your GP, you have to make an appointment to go there, you have to make an appointment to go to the radiologist to do an echo, then you have to make an appointment with the cardiologist. And time is of the essence. Time is of the essence in healthcare as acute situations occur. And we can do that. We can also support elderly people fully at home and do two-way video with the care team. And we have some amazing results there. We're empowering patients. And the beautiful young woman you see there is Kim, my daughter. We hooked her up with our care team. She basically is now using a continuous glucose meter that streams the data to her phone. Her insulin is managed. She enters what she's eating. It's measuring her stress levels and activity through her watch. And we create this environment for her where she feels well, for her, because her patterns are different from yours. And then there's this community that will allow her to talk to her caregivers, to that team that collaborates around her case. And on the other side, you see Case Doc, the internist that's guiding this whole process with his care team. A huge impact on the care of people with chronic disease. So we're looking at network care with you at the center, where in real time you're connected to your caregivers, you're connected to the sensors that help you live a better life. And we believe that by creating new incentives that are outcome-oriented, we can all align behind this. And we're going to create the ecosystems to do it. Because Pega is using our software, and we're using their software. We're using our collective relationships and networks to together create a new world of care, a new world of health. And we've been doing this for the sickest patients. The top 5% represents 50% of the cost. So 5% of all patients represent $1.6 trillion in care costs. So what we've done, we basically monitor elderly people at home. How do we do that? We ask them to stand on the weight scale in the morning. We ask them to wear a watch, to take their blood pressure. They can even talk to our Amazon Echo device, and it will ask a couple of questions. Every day these questions will be different based on the context. We'll have their medication device. And what we've seen by just monitoring these patients, proactively reaching out when we see a slight deterioration or high probability of an acute event, we can bring down the care costs by 26%. We can reduce readmissions to the hospital by 52%. We can reduce emergency care by 67%. We're not talking a couple of percentage points. We're talking huge changes to what we can do in health. And it has a huge impact on patients as well. 90% of the patients feel much better in control. 90% of the patients feel happier. They feel they can live a life with dignity. So technology is enabling the human touch. The high tech makes sure that we have the right intervention at the right time. You know, Philips has 50% of all the patient monitors in intensive care units. And it's no longer just monitoring your vital signs. It's mashing up data with your profile, with your history, with your medical records. Therefore, we can predict stuff. We can predict 24 hours in advance whether your probability of cardiac arrest is increasing. We can predict 6 hours in advance with a high probability that you're going to get cardiac arrest, which means we can intervene. We can give you the right medication and avoid a cardiac arrest. If we know that you had a stroke and we know who you are, we can send an ambulance with a mobile CT scanner so we can find the clot that's blocking the blood in your brains on the way to the hospital. We can make sure that care gets prioritized as you get to the hospital so that the procedure can be managed straight away and you'll be sent to the right hospital, because not every hospital will be able to treat you. So we're having a real impact. We're having a real impact because what we're doing, we're sensing. We're sensing you on your body, around you. If you're an elderly person and you move around the house and you're getting up at night 24 times, you have an issue. So we have to intervene. If you don't get up at all, we have yet another issue we have to intervene for. So we're sensing on the body, we're sensing in the body. Philips developed medication that you can actually track in the body. We're combining personal data, and that's not just your medical record, it's the data that you create yourself, the questions that you answer, the searches that you do, the social context that you create. We'll track the details, the deep data that we get when we do an image, or when we even go in and remove tissue and do a genetic code on that. So we're going deep. And all that information you should carry along, because it's your data. And then, of course, we want to be able to analyze the data. But 75% of that data is unstructured. It's images, observations. So how can we bring that to a point where it becomes truly interpretable, truly interoperable? And how can we create these insights that are specific to you? Then how can we carry around your pathway so that you can plug into the case handling system that supports your health? So this is how we work together with Pega. You know, Pega is the best company when it comes to complex connected care and case management. But we bring in the deep knowledge of your body, the deep knowledge of your vital signs. We bring in the contextual data that's so relevant to drive your health. We're putting that data together in a way that's HIPAA compliant, but also in a way that it allows you to link back to relevant information, actionable information for your care team, and help you essentially create your own personal pathway that tells you when to take your medication, that gives you little nudges to control your health. And it's amazing how you bring this together. It's amazing if the person you see there who has COPD can continue living with dignity. It's amazing to see that people can go on, live normal lives. It's amazing to see that we can avoid you from deteriorating into a state of bad health. And it's amazing to see that even when you have cancer or diabetes or COPD or chronic heart failure, we're there to help you, to support you, to guide you, and to connect the dots between your caregivers. So we are optimizing resources. We're orchestrating the 24/7 mission-critical care. We're focusing on that great experience because it's all about you, and we're truly connecting you with your caregivers. We think it's an amazing time to be in healthcare. It's an amazing time to create solutions that really move the needle, that recognize that health is not just about the clinical aspects, that recognize that health is about the people around you, that health is about the people like you that can support you, that can guide you, and what you can do in return. The way you can support your daughter or your dad in real time, be there when they need you, guide them when they need you, and support them. It's an amazing time to bring together that technology and give it a human touch. Make it truly human. And I think there's no better use case than what we're working on together with Pega. where we truly bring that human touch back to you. Make the care human, make the care real-time, make the care collaborative, and have a true, lasting impact on all of us. Thank you.